the emerging patterns around the world is health journalist Laura Lopez-Gonzales. Good to have you with us once again, Ms. Lopez-Gonzales. So talk to us about this number, 50% of the cases coming out of Europe. How is the vaccination drive going there then?
Right. So we heard last week that the South African Modeling Consortium released its latest projections. And University of Cape Town professor of demography, Tom Moultrie, saying that what we're kind of seeing in Europe is a little bit of sort of Europe's first Delta winter. Delta arrived relatively late to their shores. So you're seeing that much more infectious variant happening there with increasing cases. And so what Moultrie had said last week to us at a press conference was, we've sort of paid a little bit for that already. We've released South Africa has released its latest modeling projections showing those possible fourth wave scenarios. We're seeing a huge uptake in cases in Gauteng. Right now, Gauteng accounts for about 80% of all cases nationally. And really importantly, we're seeing a rise in the proportion of cases that are coming back positive, right? So it went from being a little bit under 3% nationally to just about 3.5%. So people are very concerned that we are seeing an increase, particularly in Gauteng. Those projections, though, show a smaller fourth wave than we saw in the third wave, which was, of course, driven by the Delta variant. And that smaller fourth wave in South Africa is really driven by the fact that we've got some protection from vaccines now, and some people have some immunity from natural infection. But really importantly, the take-home message there is it's not really a time to be complacent. A lot of that surge capacity that we had on board at hospitals earlier in the epidemic has been taken away, reallocated back to other health services. Not all facilities may be able to cope with these increases that we're going to be seeing in December possibly and through the beginning of the year. And also our scientists telling us that these peaks may look a little bit differently and to sort of be timed a bit differently between provinces as we move into December and the early new year.
I'd like us to continue looking at the cases in Europe. How are they looking, the trajectories in other Western countries?
I think even when we've seen pockets of high vaccination rates, for instance, in the United States, they have they have seen sort of resurgence of some cases, right? So, but what's happened is in places that had high vaccination rates, they didn't see those overwhelming hospitalizations, those overwhelming deaths, and so I think that's really important to keep in mind. I think the take-home message here as we move into December and then early next year is to really get vaccinated if you haven't. I think I've been speaking to a lot of young people throughout this epidemic that say, well, I don't need to be vaccinated because I'm not a high-risk patient. I won't get that sick. You're much more likely to transmit the virus to other people when you're not vaccinated. And certainly we saw UCT academics tell us last week that, come December, come the new year, we may be sitting around a table of family members or friends that are vaccinated or that have had past infections, but we all could be at very different points in our immunity.
And talking about December, we are seeing, countries like Italy, for example, really trying to tighten up their processes with the Green Pass to ensure that by the time December comes, the spread of the virus will not be as viral, quote unquote. Talk to us about the Green Pass as well as some of the measures that some of the European countries are putting in place for December.
I think that you're starting to see some opening up of air travel. I think that people are much more moving between countries. I think that it's still a bit of a mission to try to make sure that everyone's vaccination cards meet up with everyone else's sort of regulations. But I do think that you're starting to see air travel open up. But again, Europe facing its first sort of Delta winter, and concerns that those cases will rise because of just the amount, how more infectious that variant really is.
In South Africa now, there is the move towards a third booster shot for Pfizer. Talk to us about SAHPRA and their testing of this and the efficacy of a third booster shot for those who've already received their vaccinations.
Right. So we have seen Pfizer apply to SAHPRA for approval for a booster dose for adults 18 and over. SAHPRA is currently reviewing that evidence. That application has, for instance, passed the muster of other regulatory authorities around the world. Just because SAHPRA approves a Pfizer booster shot does not mean that it will become government policy. That's something that really is decided by the National Health Department. And there are going to be questions probably from other countries if South Africa makes that move to initiate boosters, when we, again, are barely probably going to make 50% in terms of a national vaccination target by the end of the year, about whether the country should be moving to do boosters while it hasn't really done the first dose for many people, while other countries around the region continue to struggle to get access to even like a first dose of a COVID-19 vaccine. So the questions there around boosters become very complicated.
What is the issue, Laura, at the moment regarding mandatory vaccination globally? What is the global stance? We have seen protests in some countries where individuals basically want to have the freedom to choose.
I think vaccination mandates are not very new. And, I think they go back to really like the 1700s in some cases, and have had this kind of opposition every time they're sort of introduced. They're very commonplace in most of the world's militaries. They're very commonplace in universities across the world. So, and we have seen in the U.S. where there's been sort of a big uproar about vaccination mandates for instance, police officers and people on social media saying, you're going to institute this mandate and dozens of officers will quit, and that hasn't really transpired. So I think governments have taken the position that they would much more rather advise citizens to get that vaccine and present them with the evidence that shows, you're 5 times more likely to get serious COVID-19. You're 20 times more likely to die of COVID-19 complications if you're unvaccinated than to mandate them. But certainly within some professions and some communities, whether that's college campuses or hospitals, you are seeing vaccine mandates come into effect. And certainly I think as travel opens up, you are going to have to jump through a bit more hoops in terms of traveling while unvaccinated.
Going back to the surge of COVID-19 cases in Europe, do we as South Africa have anything to worry about?
Again, UCT Professor Tom Moultrie is saying that we sort of paid our sort of dues with Delta already, and the fact that we had our Delta winter much earlier than the rest of the world, really. And so we have some immunity. We've already kind of dealt with that big surge in a really infectious variant. So it's not really a direct parallel for South Africa. But again, we're going to see projected smaller fourth waves, right? Because we've already dealt with our Delta winter, our Delta summer. But certainly no time for complacency. That surge capacity is not there in our hospitals like it was before. And it doesn't mean that even though we're going to see smaller waves in the fourth wave, that our hospitals won't be overwhelmed.
Apart from South Africa, how is the rest of the African continent faring as far as COVID-19 is concerned?
It's really difficult to say. And this is something that kind of keeps coming up when I speak to people. There's this idea that South Africa is the hardest hit in Africa. And I spoke to Tom Moultrie several months ago, about this. It's very difficult to say what the true toll of COVID-19 is in other African countries, simply because they don't collect routine death data. And by that, he explained that, if you live in a rural area in many countries, there's no incentive for you to go and report that somebody has died. There's not a burial society. There's not an insurance policy to cash out. And so what that means is that it's very difficult to tell how many people are actually dying of COVID-19, especially when we know from the World Health Organization that 1 in 7 cases is only really being diagnosed on the African continent. A very small proportion of cases are actually being diagnosed. We're not testing enough. We're not picking up those deaths. And for most countries, we'll never actually know the true death toll from COVID-19.
What do you make of that, Laura? The fact that we don't have the numbers, the fact that, we're not seeing the deaths, but perhaps more importantly, we're not seeing any sort of an analysis or any sort of numbers that will keep us abreast as to how the continent is reacting to COVID-19, and this is outside of South Africa.
I think that you've hit it on the head, right? I think that when this narrative perpetuates that Africa has been spared, that we had some sort of something about us being a young continent, or there was something particular to Africa that made it sort of come out of this in a better position than Europe. I think it sets the sort of basis for a narrative that allows for a revisionist history that vaccine makers who withheld jabs or allocated them to higher paying countries that hoarded vaccines, can sort of justify this and say, well, listen, we were hardest hit. So I think we need to continue to question that narrative and say, listen, we don't have any data to say that Africa has been spared. And when people make those assumptions, that sets a very shaky precedent for people to later on come back and say that a human tragedy was justified based on what really is a non-existent data.
Are we likely to see more lockdowns during this period, especially as we go towards the December period on the continent, in South Africa, and globally as well?
I think it's difficult to say. I think you've seen, as Europe deals with that sort of Delta winter, I think you have seen more European countries go into lockdown. I don't think that, when you look at the sort of projections that are coming out of the modeling, you don't see these huge waves that we saw in the third and fourth wave driven by those really infectious new variants, right? But I do think it's important that what was stressed to us last week was really to kind of keep up with the social distancing, to wear masks, but also to really, now is the time to get vaccinated if you haven't. So I don't know if we'll see the kind of hard lockdowns we saw last year. You may see, again, and this is what was always intended with the way that South Africa had sort of characterized its risk levels based on very localized data, you may see some restrictive measures happening in one province before they happen in another province. Because again, these surges or these fourth waves are not expected to be sort of a national journey we take together. It really seems, from the projections at least with the modeling, that there'll be sort of a provincial story to these.
Laura Lopez-Gonzales, always a pleasure speaking with you. Thank you so much for your time. She is a freelance health journalist.